Hello everyone, welcome to this special session in our Peers Under Pressure series. Some of you will already know us here at Oscar, and of course if you've joined any of our previous webinars you'll also know some of my guests this afternoon, but a very warm welcome to everyone and our colleagues in the United States. Early morning over there for them. So without further ado, let me introduce you to everyone this afternoon. I'm delighted to welcome some experts in their fields. Firstly, a very warm welcome to Valerie Dowley.
Hello.
Valerie is an independent tissue viability nurse specialist with many years experience in community healthcare settings. She is also a nurse lecturer at the University of Brighton and on the foundation degree for health and social care practice, and provides tissue viability teaching to pre and post registration students across the School of Health Sciences. Welcome also to Anita Morton, Oscar's clinical support nurse.
Hello.
Anita has more than 20 years experience in community nursing, teaching and industry, coupled with an extensive background in nurse education, pressure area care and negative pressure wound therapy. Anita truly believes education is the key to excellence in patient care. I'd also like to welcome two special guests this afternoon. Firstly, Stacey Cole, Chief Nursing Officer at Mercy Hospital in the United States, and Sean Townsley, Director from Hercules, again in the US. Daniel Woodcock is Oscar's Client Partnerships Director. He's also joining us, and he has experience in delivering some of the most challenging and complex NHS projects across the UK. And finally, I'm Emma, and I will be your chair this afternoon. We want you to get as much out of this session as possible, so please do use the Q&A function on Zoom to participate today. These guys truly are experts in the field, so it's a great opportunity to ask them the questions. So with our introductions done, let's get on with our session. Reducing nurse burnout, fatigue and injury at the touch of a button. Our vision is to enable healthcare organisations to save time and money and eliminate hospital-acquired injuries. We believe good patient care starts with good staff care. In short, a healthy workforce leads to improved patient care. We're here today to see where innovation begins with our staff and how Oscar is working with the NHS across the UK. At this point, I'd like to hand over to Daniel.
Thank you, Emma. Appreciate the welcome to today's webinar, and thank you everyone for coming on. Some of you would have heard of Oscar before, some of you will be new to Oscar. We've been in the healthcare market industry for 25 years and have a range of expertise and experience in delivering pressure care solutions to the acute sector, hospitals, to long-term care settings and hospices for the palliative care need. You'll see on the screen here, we've got 4 key categories that Oscar cover. We've got the patient repositioner, pressure relieving mattresses, patient falls prevention, and our seating innovation. Today, really, we're going to focus on one of those, and that is the patient repositioner. So I'd like to hand over to Valerie to kick off setting the scene. Thank you.
Thank you, Daniel. So good afternoon. So to set the scene today, it's important that when we look at workplace stresses, injuries or burnouts, that we remember that the NHS employs about 1.3 million people in England, and there's about 1.6 million jobs in the adult social care sector. And if we put both of those together, potentially, we have 8.6% of the working age population to look after. Not only is our health and well-being dependent upon the commitment of these staff, but many people have friends and family who also work for the NHS or care systems. And it's essential that they're able to carry out these roles safely and effectively. Next slide, please. Due to the nature of the jobs, care staff are really exposed to a great deal of musculoskeletal stresses and are at much higher risk than those working in more sedentary environments where physical movement and strength are not part of their remit. With the physicalities of a nurse carer's daily workload, there is a tendency to overdo certain activities such as lifting patients or turning them, bathing patients or moving equipment, especially if they're under pressure with high workloads and time factors. The result is usually muscular or potential ligament tears, sprains and strains, particularly around the spine or the back. According to the workplace injury statistics in the UK, 35.5% of UK nurses had experienced a musculoskeletal problem because of work-based activities in the last 12 months. And this is a rise of 33% on previous statistical audits. This rate is significantly higher than that of workers across other industries. And although retail and wholesale is in top position for work-based injuries, it is sad to hear that nursing ranks as second on the list. And while certain steps can be taken to prevent some injuries, it is inevitable that they will occur, and to a certain extent, potentially more long-term and debilitating. Next slide, please. So if we look at a recent 2020 study by Wigerman et al., and this study looks at the effects of repositioning aids alongside patient weight on the biomechanical stresses put on carers while repositioning in the bed, we can see the following things. When undertaking manual repositioning with aids, and when we talk about aids, we talk about things like maybe draw sheets, slide sheets, the Wendy-Lett type sheets. It does show that spinal compression and hand forces exceed recommended limits for many patient weights and repositioning activities. And although they looked at other devices, and although spinal forces and hand forces didn't exceed recommended limits when using things such as air-assisted repositioning devices, what it did note was that each repositioning activity resulted in an increase in cumulative workload because they had to put these systems in under the patient and remove them on each repositioning activity that they did. And lastly, the patient's weight should be considered when determining repositioning aids to use. The findings of the Wigerman study reinforces a recommendation for using mechanical lift equipment, which should be considered as a robust alternative to repositioning aids, and equipment that can safely accommodate all patients regardless of their weight. Next slide, please. So let's look at what we could define burnout as. So it's defined as a syndrome conceptualized as resulting from chronic workplace stresses that have not been successfully managed, and is characterized by three dimensions: a feeling of energy depletion and exhaustion, increased mental distance from one's job, maybe a feeling of negativity or cynicism relating to one's job, and a reduced professional efficacy. If we look at some more statistics, the latest 2021 NHS staff survey showed that 53% of all NHS staff reported feeling unwell as a result of work-related stresses in the last 12 months, which is a rise from the 2020 figure of 49%. Similarly, when you break that down a little bit more, a record 43% of nurses and midwives said they felt unwell because of work-related stresses in the past year, compared to 49% in 2020. Some further statistics from two other studies, Oxby and Mitchell, show how in 2021, 45% of nurses and midwives said they often or always felt burnt out due to work, compared to the 33% average across the NHS as a workforce as a whole. So these findings also show that 52% of nurses and midwives looked forward to coming to work, which sounds great, except that it's down from 60% in 2020. Next slide, please. So not only do we need to think about looking after our staff, we also need to consider the importance of posture management and patient repositioning in pressure ulcer prevention. Excuse me. Body posture and positioning is so important when it comes to pressure ulcer prevention. The more of a body that is in contact with the support surface, the better, as we get a more even pressure redistribution from an increased surface area. In reality, our bodies can really only withstand high pressures for a short period. And so we must think about using positioning to assist in helping relieve some of that pressure. Posture and positioning can also have a direct influence on pressure going through specific body sites. So as we can see from the interface pressure mapping images on the left-hand side of this slide, When a patient slips down the bed, there is less body contact with the support surface and a significant increase in the interface pressure to the really vulnerable areas such as the sacrum and the heels. So appropriate postural management and equal weight redistribution with adequate pressure redistribution and a regular change of position can help a person to reduce a person's risk of developing pressure injury. So that's all I wanted to say to you today. So I'd like to now hand over to Stacey Cole for her perspective on having used the Hercules. Thank you.
Thank you, Valerie. So as a chief nursing officer, in my role, I'm a market chief nursing officer and I oversee 5 hospitals. And we have been able to put the Hercules mattress into 5 of our units so far. It's definitely been a great venture for us. And I will tell you, in surveying the nurses that have the opportunity to use these mattresses on their patients, we have heard a resounding positive feedback from them. Actually, about 78% of those nurses say that it has increased their job satisfaction. They feel like they're going to stay on the job longer. They have less complaints when it's the end of their workday. We have heard from nurses who have been floated away from their units where there are Hercules mattresses to a unit that may not have them in place yet. And the one thing they notice at the end of the day is the difference in the way their back feels. And they're glad to go back to their unit to be able to use the Hercules mattress. So we have been working diligently with our capital dollars to be able to install Hercules mattresses on more units. Or if we open up new units, we make sure that they're equipped with the Hercules mattress on them so that both for the patient and the nurse, this is definitely a win for us. I'll share with you just briefly a story. We had put the mattresses on a intermediate unit in one of our hospitals, and a patient was improving, so they got to go to a lower level of care, and the patient actually refused to be moved off of a mattress with off of a bed with a Hercules mattress. So he said it was the best feeling he'd ever had as being a patient in the hospital. He was a frequent patient in the hospital, and he wasn't sure exactly what this was all about, but he was sure that this was the mattress he needed to be on every time he was in the hospital. So we've heard great feedback from our patients and excellent feedback from our nurses who have the opportunity to use them. So I think it goes a long way when we hear the nurses who actually note that this could potentially be a tool that will increase their longevity at the bedside. Of the nurses that we surveyed, around 55% of them said that it would keep them at the bedside for at least 5 more years, based on being able to have the ease of use of repositioning a patient in their bed, not having to look for additional staff to pull into a room to be able to reposition a patient, and just the overall feedback and perspective that they get from their patients. It makes them feel good to know that the patient is comfortable in the bed and that we're making sure that we're doing all of the things that we can do to prevent a hospital-acquired skin condition. So a lot of positive feedback, like I said. I think when we asked the nurses, what would your recommendation be on investment in Hercules mattresses, continuing to grow, 100% of them said they would definitely recommend that we continue to invest dollars in the Hercules mattress. So I appreciate your time today, and I would entertain any questions that you might have.
Thank you, Stacey, for sharing such valuable insights into using Hercules in your hospitals. Let's head over to Daniel now to have a look at Hercules in action.
Thank you, Emma. We're going to move on to giving you a brief demonstration of the Hercules. What we have here is the drive unit and our Series 5 or Series 6 true hybrid mattress. Now, just for some of you may have heard of those 2 mattresses before or heard of Oscar before using those systems. For those that haven't, the Series 5 is our lateral tilting mattress, which has the 4 air cells running long ways down the mattress. 2 of the air cells lower and 2 of the air cells come up in a 10-minute cycle. So we're getting that gentle offloading every 10 minutes. It's worked very well in the community and in the acute setting. And then our true hybrid is a step up, step down system, which is when you add the pump, you've got treatment of category 3 and 4, and without the pump, you've got 1 to 2, category 1 and 2. I'm going to hand over to Anita, who's going to give us a brief demonstration on how the Hercules works. And we've got someone that's going to hopefully jump on the bed as well.
Absolutely. So, hi everybody. So yes, with the Hercules then, we have a complete sheet replacement that obviously goes on top of the mattress. So there's no additional bed sheet required. It doesn't go on top or underneath. The sheet from the Hercules is completely the only sheet you will need. In order to keep your patient safe as and when they are being boosted on the Hercules, you've got just some retention straps here that will just allow your sheet to be clipped in, and obviously will keep your patients safe as and when they are on the Hercules. If I can get my lovely assistant to jump on. No. So if I can get you by just a second. Be my patient that has slid down the bed. So as you can see at the moment, we've got our patient here who has slid down at the bed, and we know therefore, as you can see, that the pressure going through the heels there is going to be high, as the same as through the sacrum as well. And also posture-wise, is in that crunching kind of position. So it's not good for various different things. So in terms of the Hercules, what it's actually going to do is boost our patient up the bed in a single-handed care method. So it's only me that is required to do this. I don't need to come and get other staff members at all to come and help me boost our patient up the bed. So there's just nice handy controls just built into the side here, so I can move the patient up the bed with just one press of the button. And as you can see, the sheet, which is an extra longer sheet, then glides with the patient up the bed, moving them without any fear or friction. And hopefully you've just seen that as soon as the sheet has moved Barney up the bed, then it will release as well, and that just helps to prevent any hammocking, so that we haven't got a taut sheet. It's obviously working therefore then with the mattress underneath. I'll hand back to Dan.
Thank you very much, Anita. That is the demonstration. Emma, I think there's been quite a few questions coming in from the audience. Whether you just wanted to run through a few of them, that'd be great. Thank you.
Yep, so one question that's come in is, looking at the sheet, as and when it moves up the bed, it looks quite taut. If it is on the lateral tilt mattress, for example, will the sheet affect the mattress's ability to immerse and envelop the patient?
No, not at all. It's because as and when we finish boosting, the sheet releases, it's actually going loose essentially, so it's enabling the immersion and envelopment still, so it's not going to affect the way the mattress works in any way. And we also get the reduction of shear forces with the Hercules, because the sheet is actually moving with the patient and not kind of the patient isn't dragging along it at all.
And you can actually move from side to side quite easily.
Yeah.
So that if you still get that immersion element on a side to side move as well.
Absolutely.
It's not tight over the mattress.
Thank you, guys. What is the weight limit of Hercules, and is there a bariatric version?
Good question. Yes, it can take bariatric patients. The weight limit is 350 kg, roughly 53 stone. So it can carry a lot of weight, and we can adapt it to a bariatric style mattress. That's not a problem.
Okay. Another question. If the patient soils the sheet, is it easy to change, and how would you go about this?
So yeah, it will be easy to change. So you can release the sheet from the clips there quite easily, and then you would change that the way you would any other sheet. So you would need to release it from the drive unit first, but once you've done that and you've unclipped the sheet, then it's just either log rolling as you would do normally a sheet, or hoisting as appropriate.
That's great. Actually, one question that's come in from a couple of tissue viability nurses who we've got on the call today is, doesn't it cause more shear forces?
It shouldn't do, no, it won't do really, because what, like I said earlier, what actually happens is the sheet is moving with the patient. So it's not that the sheet is staying stable, or the patient's kind of being dragged in any way. So it actually will help to reduce that shear force, because say it's working with the patient, it's not working against them in any way.
Okay. Another question that's just come in, is it a specific sheet for the bed, or will any bed work?
So yeah, it is a specific sheet. So it is a sheet that is designed for the Hercules drive unit and to be in place with the mattress. But like I said earlier, it is a complete replacement. So there's no additional sheets that are required in any way. And it is a special sheet because it has to be extra long, because ultimately you get about 10 boosts from this. And so yeah, obviously a standard size sheet wouldn't work.
We're trying to get it so it's covering off maybe a day or someone's whole shift. So if you take an average boost of about 12 inches back up the bed, you can do that 10 times with the sheet, because the sheet is double the length and the sheet is kept down here. So we can have Barney slip down the bed 10 times and we can still boost him back up the bed. And on another point I think that was raised, can it be used on any bed? It can be fitted to any bed or mattress. That is easily done.
Okay, that's great. Infection prevention and control, really great question. Can the drive unit be easily cleaned?
Yeah, the drive unit's very easy. It has an entrance where the sheet goes in, which is designed for you to use, for example, in the acute hospitals will probably be using clean air wipes. Really easy. Once the sheet's taken off from the drive unit, we can just simply wipe that down with our wipes and follow just any normal procedure we have in place for cleaning our medical equipment and medical devices.
Okay,
Sorry, just on the sheet, it is actually, this is a launderable sheet we have here. We have two options, either a launderable sheet or a disposable sheet.
that's great, thank you. Okay, one more question. How long does it take to do the boost with the unit in place? I guess that's versus a manual moving the patient with two nurses. What's that time difference that it takes, or that time saving, should we say? Yeah,
so we just saw it with Anita there. Let's just do it again, maybe, Barney. This one pop off again. So we're not needing to reset the sheet at any point because we've still got the 10 boosts. But Barney, if you want to hop back on and be our patient, just slid down the bed. Yeah. We now come into the room. So traditionally what we're going to be doing here is Anita's going to be going and finding someone else to help her. Yeah. Probably going to go and find a slide sheet. If you have disposable slide sheets, they might be quicker because they're by the patient bay, but if not, you've got to go to a cupboard, make sure you get the right one. We know on a ward it's very busy, so there's that time delay, and then you've got to come and obviously set the patient up, but drive on with the sheet.
Yeah, so for me, obviously alone, I can literally just with the press of the button, slide our patient up to bed to reposition.
So we're saying on average it's around a 10 seconds boost from the base to the top of the bed. Through some surveys that we've done over in the UK here, in about 7 acute settings, we've been collecting some data around how long it's taking currently, and it's anywhere between 15 minutes and 30 minutes it's taking someone to go and find the equipment, come back, set up, and then boost someone back up the bed, taking the equipment out and putting it away.
I guess this is a really good opportunity to bring Stacey in here and get her experiences on just what kind of time saving you've experienced in your care settings over in the US.
Sure, definitely. You know, and like I mentioned, a nurse only having to be able to go into a room and reposition a patient by themselves. So that in itself is a time savings. Not looking for additional staff to be able to go into the room to reposition a patient. So that's the number one thing we've heard. Also, in talking with nurses in the changing of the sheets, they feel like it's very simple to change the sheet out. It doesn't, you know, take a lot of additional time. If the sheet gets soiled, it's easy to change out. We have actually brought our infection control nurses into this process, so they're aware of what's going on, as well as our wound care nurses. So they understand the use of the Hercules mattress in the sheets. and they feel very confident with it also. But, you know, as far as timing goes, I think the biggest time saver is just the ability to pull a patient up and not have to get additional staff.
That's great. Thank you, Stacey. One last question. Would you not still recommend slide sheet under heels to allow the lower limbs to readjust in the scenario as seen?
To be honest, no, because again, the actual sheet is taking those feet widths. And again, there is no drag, there's no shear that will be happening on the heels there. And so the body just glides with. So no, you wouldn't need to be using an additional slide sheet under the heels or lower limbs.
That's great. Thank you.
There's been quite a few, Emma, that have been asking, is there any way of getting more information or even trialling it in my hospital? I'm just about to launch a poll that if you are interested in hearing more, please just click yes on this and someone will be in touch with more information afterwards.
Could I just add a little bit just to complement that question on shearing as well? Because I think it's important to remember that with the Series 5 and the Series 6, it does have an anti-shear zone within the mattress itself, which has a sort of a slide sheet effect, which we can't show you here, but we're happy to demonstrate at another time. So not only have you got a slide sheet anti-shear under the cover of the mattress itself, you then have a system that doesn't cause friction when you pull when the patient is repositioned. So there isn't this sliding movement. It is just bringing the patient with the sheet up. So you've got a double factor here that's protecting the most vulnerable areas from the shear forces.
Thank you, Anita. I'm very conscious of time. We've got some chief nurses on the call who are incredibly busy people. So what I wanted to do is wrap the session up. If you'd like more information on Hercules, you'd like a demo or you'd like to have it trialed, then please get in touch with us using the chat or the Q&A function and we'll come back to you. Valerie, Anita, our colleagues in the US, Sean and Stacey, and you, Daniel, thank you so much for joining me today to showcase how we can support our precious NHS to become Hercules strong. It's been a pleasure again to work with such an amazing team. To our listeners, thank you for joining us today. We hope you've enjoyed the session and you've also found out how Hercules can really drive some clinical improvements within your day-to-day working environments. We've recorded the session, so if anybody would like to watch it again, we can send you the link for you to watch it on playback. And of course, as I've said, if you would like to chat with any of our experts or we haven't managed to answer any of your questions live today, we will come back to you, or please reach out to us at nurse@oscar.uk.com. So all that leaves me to say is thanks again everyone for joining me, and we hope everybody has a great afternoon and evening. Thank you.